and I'll be looking for the station to get ready to start. So today we have Dr. Leigh Erin Connealy. I'm excited because I finally got to meet her. Beautiful, beautiful person. And we're going to be talking about prostate and ovarian cancer and how to heal the body and keep it from getting to that place. And so fasten your seatbelt. We're going to learn and grow together. And I have a feeling that we're going to be starting pretty soon, but I have to wait till I hear that I can start. Here we go. So I'm a little bit running earlier here. There we go. Okay, here we go. Hello, my listening friends. It's so nice we can meet each other on the air on this beautiful, best day ever. And for those of you who are new to the Lillian McDermott radio show, the purpose of the show is to provide a safe place where you can go to when you need a friend. It is my commitment to provide alternative ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my viewing, as well as my listening friends, will feel empowered to embrace a new truth and live the life of your dreams. And so today, oh my goodness, I hope you have 407-373-5959 in your phones, because we are giving the Cancer Revolution, a groundbreaking program to reverse and prevent cancer by Dr. Leigh Erin Connealy, MD. Be the 10th caller or texter. 407-373-5959. Now, Dr. Leigh Erin Connealy is quickly becoming a regular on my show. She is the author of The Cancer Revolution. Of course, 10th caller or texter gets a copy of this. And although she helps patients heal naturally, she also helps patients heal after conventional treatment. There's so many different ways, or prevent disease entering into your body. There's so many different ways that she helps people heal. And so today we're going to talk about the prevention of prostate as well as ovarian, and maybe who never knows, we might even go into other areas, but specifically that, because I've had many people send me this request, especially men want to heal this prostate, it's like a mystery, but is it really? And since it is our sole purpose in life to give and receive love and knowledge, I am so grateful that Dr. Leigh Erin Connealy is here to do just that. Welcome back, Dr. Connealy.
Thank you, Lillian. It was great to meet you in Orlando.
That is true. And this is the second time that you've been in Orlando, but it was the first time we actually met. And, and we were standing like a little bit further away from each other, and it was like a reunion. It was so nice to see you. I tell you what, the best answer for cancer, of course we had the conference there, and it was the 17th annual for the doctors coming back for CEUs, but you also were a part of the summit, the Answers for Cancer Summit. But I snuck in, well, I didn't sneak in, I snuck in some people because I wanted them to, because I knew you weren't going to be speaking to the general public. And I snuck in a couple of people, and every single one of them came to me afterwards and said, thank you for that gift to see Dr. Connealy, because if I ever were to get cancer, she's the one I'd want to go to. That is what you evoke in people.
Well, that's my mission, is to awaken and to enlighten and to educate and empower patients how to live the best life ever.
That's right. So share a little bit about yourself and what prompted you to this passion to help heal the body of disease.
That's so funny you say that, because I'm going to redo my website. and I said, I need to probably, the intro should be me and my story, so people understand, okay, I'm not just this cute little doctor that, treats cancer patients.
Yes.
And so I got home early yesterday, and I get home usually so late. And now that the time has changed, it doesn't get dark till late. So,
yeah.
So I have this hill I run up and down, up and down, up and down. And so I said, in preparation for today, I'm going to go do quite a bit of hills, hills and down, up and down. And so out loud, I was saying what I would say to the camera when I do my introduction on my website, because I'm completely redoing, because as you said, everything is changing and there's so many facets to cancer. And when patients talk to me, I want to I want them to know, like, well, did you think what a biopsy would do? Did you think all these things? Like, you know, you need cancer rehab. If you go and get conventional treatment, you need cancer rehab after that. And then, you know, all the things to ask doctors when you're in the conference with the doctor. So anyway, I was talking out loud to the universe last night, and I was like, okay, I'm Dr. Leigh Erin Connealy, and I'd like to say I'm a Nobel Prize winner, I'm a genius, and I really, really had this dream of building the largest integrative medical practice in the world. But that's not true. And this situation, what I've created, has picked me. And so it all started when I was about 16 years of age. And my parents found out that my mother took a drug when she was pregnant with me, and the wonder drug DES. For our listeners who don't know that, DES is diethylstilbestrol. And I'm number 3 of 6 kids, and I'm the only child she took it with. And so anyway, that's when it started.
Yes. And so this is what we're going to be talking about today, Dr. Connealy's story and her journey, as well as how she helps patients grow and learn about their bodies. The Cancer Revolution, be the 10th caller or texter, 407-373-5959. And we're going to continue our conversation with Dr. Leigh Erin Connealy when we return worldwide at whenyouneedafriend.com. We'll be right here waiting for you. Yes, that story of, you can share a little bit about it now for people that are tuning in.
Because my little speech was longer. So.
But we got you going up and down the stairs.
Yeah, I wish I was recording it, but I'll be able to redo it. But you know how
we're recording right now.
Yeah, but meaning I recorded it, so I would not forget every facet. I had it all perfect last night.
Yes, yes. And you know what? At the time that you share it, it will be perfect again.
Right, it will. So it was just funny that, you know, I had it all in my head because people always go, oh my God, I believe, you know, I have a dream I'm going to be a gold medal downhill skier. Okay, well, you know, that's all great and dandy. But you know, I wanted to be a doctor, and for sure I wanted to be a doctor. And there was several reasons why I wanted to be a doctor. And so, but when you start out, you don't have any idea of what you want to do. You don't really, because you don't know. You're young, you're stupid, you don't know what it's going to entail. and which is always a good plan, because if you knew what you were going to get into, might not get into it.
That's right. That's right.
So I believe that you have a seed. I really do. I remember meeting a violin maker, and I've never met a violin maker. And violins are very, very beautiful, amazing instruments. And I remember meeting, he was French and from France. And I said, wow, like there's not that many violin makers in the world. And then you have to be actually planted a seed by God to make violins. So it's changed now that I'm 60 plus. I'm like, you know, we all have a seed that's germinating. And so that's why we can't be judgmental, because the seed is the good and the bad. And if you don't master a unwanted condition, then you can't be good. You can't be great. You only become great by overcoming and being victorious in your problem.
And we're about to get started, Dr. Connealy, and we're going to dive deep into the emotional side, all the different things that you talked about in your talk. And here we go. Welcome back to the McDermott Radio Show, where you can listen worldwide at whenyouneedafriend.com. I am so excited that we have Dr. Leigh Erin Connealy. You can find her at connealymd.com. All the information. If you're a subscriber at whenyouneedafriend.com, you would have all this information at your fingertips. So Dr. Connealy Dr. Connealy, ConnealyMD.com. That's ConnealyMD.com. And so today we're giving away the book, The Cancer Revolution, 10th caller or texter, 407-373-5959, and you will win your copy of The Cancer Revolution. Dr. Connealy, like I said to you, I just loved your talk at the conference, and for the best answer for cancer. And I know that the cancer, it's the integrative oncology cancer conference that they had in Orlando, and you were so spot on. The first thing you said, and I don't know if you remember this or if you were planning on saying this, but one of the first things you said when you got up in the podium, you said, doctors, if your patient doesn't do the emotional work that is needed, then you may not want to treat them yet. Let's talk about the emotional attachment when it comes to cancer before we even dive into the prostate or the ovaries.
Right. So that is, I did say that, and it's interesting. That took me 30 years to to ascertain and figure out what we need to do as doctors to really help and enhance our patients and get them well and to create radical healing.
Yeah.
And so when I see a patient, because a patient is suddenly diagnosed with cancer and they're in fear and trepidation, and that in and of itself is its own emotional problem and challenge. But we are an emotional creature from in utero, all right? And then that is matriculated on. And so when I see a patient, they're just concerned with the cancer and how to cure the cancer and how to get rid of it, and that's all they think about. So of course, as a medical doctor, I am addressing the cancer, and okay, here's what we need to do, and we need to do this blood work, we need to do these scans, we need to get this information, we need to get this circulating tumor cell, etc. And so, but then I will say, okay, tell me how you're eating, and I will tell you that 100% of patients for the past 5 years, believe it or not, since their diagnosis, have radically changed their eating, which is they get off sugar, they get off carbs, they're juicing, they're doing a lot of things. So that shows you that subconsciously, we really know that we need to eat well, because all these patients change their eating, okay? So then I go, okay, so tell me what your life has been before. Usually I go back about 10 years. It might be 5 years, 3 years, 5. And patients will say, oh my gosh, I've been under extreme stress. I work 100 hours a week. I'm taking care of my mother with Alzheimer's, my child overdose, whatever. It could be
always a story.
Sundry of issues. So I tell them that my first 2 things that I want patients to do, the day they come in, I usually draw their blood. But the first 2 appointments I have them make is learn how to eat and learn the science of food, because we are a biochemical experiment happening 24/7. And the food that we eat is directing our biochemistry, okay? And every doctor learns this in medical school. So if you don't have zinc, for example, you can create cancer just with the lack of zinc, because zinc is critical to the immune system. Now, there's a lot of other vitamins that are critical. But then I tell people, I want you to meet with our expert in emotional conflict resolution, because we all have it with our mom, our dad, our children, or something traumatic, PTSD, maybe somebody was raped, maybe someone had an abortion. So we all have an emotional conflict, okay? So we know that our emotional DNA goes back 9 generations. But and our subconscious is 20,000 times more powerful than our conscious. So, and a lot of us subconsciously sabotage ourselves every day without even knowing it. So, but we need someone objectively to help us, because we are subjective and we can't we can't, all we know is our world. Okay. So we need someone that can navigate emotional conflict resolution. And there isn't a soul that doesn't happen. So it's not like there's something wrong with you, because there isn't something wrong with you. There's something out of order that we need to get in alignment with the flow and energy of the body. And so now I will tell you, a couple of years ago, I did not do that. But now I really delved into all of how the emotion, and I've studied many, many people. And this is something that has been thought about, coined for hundreds of years now. Okay. And I just wrote an article that will appear in Townsend Letter, The Biology of Hope. And it talks about all of this. So stay tuned for that. It's not out yet, but it'll be in the Townsend Letter, which is a great journal for patients to learn about integrative treatments. And so it will be published in there. And actually, everybody always asks me, well, what's your next book? What's your next book? And I said, well, I think it's the spiritual, emotional component of illness.
I love that. I think people are beginning to become in tuned. It's a lot easier for people to fix the body than fix their spirit. It's almost as if we're unwilling to look in the mirror. I call it my soul shovel. To take that soul shovel and dig until there's only truth. For some reason, people don't see the value and think it's nonsense that something that happened in your childhood or something that happened to your parents got transferred onto you, that you're still bearing that burden. So it's important, and you said that so clearly. The doctor next to me said, that's not true. But I knew better, and I was not going to get into a debate with them because he wasn't ready to hear it. But
Right.
Those who were ready to hear it heard you loud and clear. Before you spend a dime of their money, make sure that they understand these two things. That the emotional component, and of course nutrition, which you dive in. We've talked about this before. And for those of you who want to learn more about Dr. Connealy, we didn't dive into all how wonderful her background is, medical and her experience, but you can go to whenyouneedafriend.com and research her there, all the past shows that we've done. Okay, so when somebody comes in and they have prostate cancer, you had talked about, the problems with doing all this research, like the biopsies and all of that. But you're saying, this is the easiest to take care of. So talk a little bit about the prostate and how easy it is to take care of.
Right. For our listeners, prostate cancer is the number one cancer that I treat. Okay. And I believe the reason is gentlemen do not want their body invaded upon. So I have a great alternative for them. So girls are used to going to the doctor. They're going to the doctor. They're having babies. They're having pap smears. They're having this. They're getting beautification procedures. But guys, hands down, 100% of the time, do not go to the doctor. Every gentleman who comes to my office comes in because their wife, their girlfriend, or daughter dragged them in. Okay. And so, and in fact, I saw a gentleman yesterday. He's newly retired, 63 years of age. And I said, so how did you come in today? He goes, oh, my wife just saw you a couple of weeks ago and just loves you. Okay. And so it told her, you're going to love her too. So, because I know how to meet men where they are, which is what you need to do, because men are very, very orderly. They tell you your problem. They don't fuss about things, and they want a plan and a solution. And so I'm good at that.
Okay.
So prostate cancer, it's a very, very small gland. It is a growing exponentially prostate cancer. All right. But number one, we need to try to prevent prostate cancer, right? I mean, that's just what we need to do. We need to try to prevent an early detection. And let me give you a case in point. I had a gentleman who I've been seeing for 20 years. He came in once a year for his physical. He had a PSA of 1 and a lot of experts say don't use PSA, which is true. Even the founder and discoverer of PSA says it's worthless. Okay. So this gentleman went from 1 to 2 in 1 year. And I said, oh, something's up. You've been one for 20 years. Now there's something going on.
Mm-hmm.
So the typical conventional assessment is go to the urologist. Now, the typical urologist in his case would have done nothing.
Yeah.
Nothing. They would have said 0 to 4 is normal. Year 2, get out of here.
Mm-hmm.
Literally.
Mm-hmm.
Okay. So they're not going to really do anything unless on digital rectal exam they feel something or the PSA is high, a little high. Now they're a little bit more attuned to things. So in this gentleman's case, I go, okay, there's something wrong. This patient obviously believed in what I said. So I said, look, let's take a look at your prostate. So how do you take a look at your prostate? We order a color Doppler ultrasound. And a color Doppler ultrasound is a procedure that beautifully illustrates your prostate. And it will tell us if there's any aberrations, any irregularities, if it is large, if there's a nodule, et cetera, et cetera, et cetera. So, and guys like that because it's like, no, nothing invasive, nothing painful, no suffering, et cetera.
Yeah.
And then there's another way to image your prostate, which I usually do both, is I order an MRI. An MRI is also a beautiful picture. It's a little different picture than the color Doppler ultrasound. So before we invade into the body, now if you went to a regular doctor, they wouldn't order a color Doppler ultrasound. They may or may not order an MRI. They'll just go, okay, we're going to biopsy. Okay, well, have you ever tried to pull seeds out of a strawberry? That's what doing a biopsy is in a prostate. So you just poke and you poke and you poke and you poke, and they do 15, 12, 20 biopsies. Well, every biopsy is creating inflammation. When you create inflammation, you create a possibility of cancer. So why would we do that? Why wouldn't we know exactly at 1 o'clock on the clock where we're going to go? Okay. And then the aftermath of having that many biopsies, a lot of guys, they're in pain, they bleed, all kinds of complications. So that's archaic. We don't need to do that anymore. I mean, I never have. The only time I have patients that they've gone to someone else before me and they're like, oh my God, why didn't I come to you?
Yeah.
So the investigative process needs to be completely different. And today, even I have someone coming in to know if there's a new test now for early detection. So one of the tests I do for early detection is I do a rectal exam and then I have the patient pee, and then they check something called PSMA. And the PSMA tells me there's a possibility, a good possibility of prostate cancer. So why wouldn't you do that? So it's just so sad that, and I'm not a urologist, but I want the least aggressive, painful procedure for
Very good. And we're going to continue our conversation, the cancer revolution. Dr. Leigh Erin Connealy, 10th caller or texter, 407-373-5959. And we're going to continue our conversation. We'll be right here waiting for you. Yeah. That poking and prodding has got to stop. You know, just recently there's an article that was published in the Wall Street Journal saying that, you know, maybe we're doing things a little wrong. You know, they're trying to bring down the cost of cancer therapy. They're trying to bring it down. And they did a study. And of course, you know, and I know that there was much more than just a study that showed that people that were doing chemotherapy versus that didn't do chemotherapy and they did alternative treatments. And so the insurance is trying to figure a way to bring the cost down. They said that, you know, they're not going to offer chemotherapy right away. However, they did not say in that article that what they are going to offer is to pay for alternative therapies. They're not saying that. They're just saying we're not going to give you chemotherapy right away. So a lot of these doctors are poking and prodding, and they're creating cancer.
That's true, and it's proven. You know, it's actually proven that we are creating cancer. We create inflammation with any biopsy, whether it's a lot of biopsies of the prostate or one biopsy of the breast or the liver or anything else. So what I do is, because the standard of care is biopsy, because unfortunately you need to know the characteristics of the cancer. So is it estrogen driven? Is it progesterone driven? Is it HER2 driven? Now there is the blood test in Greece that will show these features, but sometimes the blood and the biopsy are different. So because I need to, do the right thing all the time, so I just prepare the patient for the biopsy. So, and do cancer killing and decrease inflammation by all the necessary things. And, they're okay.
Yeah. Yeah. Okay. So what would you say and to a person, because we're going to take, let's hold off going back there for a second. For someone who has a prostate that has been elevated, because you talked about from 1 to 2, that your patient, you knew something was going on, and you just wanted to be proactive.
Yeah.
So if somebody has a PSA of 11 and they've poked and they prodded twice, or they poked and prodded 3 times and there's no cancer, you talked about that on your presentation, that what you really need to look at is the T cells. Does that still something that you are?
Oh no, you need to look at the coexisting situation. Does the patient have high mercury? Do they have a yeast infection? Do they have some other kind of infection that's causing this elevated PSA, right? Do they have too much estrogen, right? A lot of guys have too much estrogen, xenoestrogens and regular estrogens. So you've got to look at all and then a lot of people need to clean up. Once you clean, it's amazing, once you clean up the body, right? A lot of inflammation goes down. And one of the biggest things with prostate is candida. That's one of I would say the biggest thing with prostate is candida and elevated mercury. Mercury lodges into the prostate, and also ovary also. So
mercury, that's tuna.
Well, no, that's amalgams, that's air pollution and fish. Correct.
Okay. Well, here we go. Welcome back to the Lillian McDermott Radio Show, where we always learn from one another. You can hear us worldwide at whenyouneedafriend.com. I am your host, Lillian McDermott, and it is my goal that we learn from each other. Go through life with childlike wonder and learn from the person you're with. Remember, you can learn what to do, and you can also learn what not to do. Either way, you are a teacher, you are a student to somebody else, or vice versa. So I want to encourage you to go to whenyouneedafriend.com, where we have these conversations. Please become a subscriber. Subscribe to my YouTube video, which, by the way, we have some information. Dr. Connealy was sharing some information about prostate and the importance of checking to see, which is fascinated, that a lot of people that have a high elevated prostate could possibly have candida, and we just talked about that recently on the show. So we're going to continue to dive deeper. I want to encourage you to make sure you check out my sponsors and support them the way they're supporting the show. Go to whenyouneedafriend.com, subscribe to to YouTube as well as my website, and like me on my social media. Do that now before you forget. And the 10th caller or texter, 407-373 5959. You can hear the show as always. You can stream it on whenyouneedafriend.com. You could also listen to it later. If you subscribe, it'll be sent right to you. So, Dr. Connealy, you said some incredible stuff while we're off the air. So I want to encourage everybody to go to the YouTube video. I'm not going to repeat it, but it's very important information. So when it comes to, because I want to give it some equal time, you had mentioned that ovarian cancer off the air, because we haven't talked about ovarian cancer just yet, that could also be candida?
Well, unfortunately, with all cancer patients, candida is present. There's a great website, and I met Dr. Simoncini years ago, probably 12, 14 years ago. We were both being interviewed for a show, and it was the first time I met him. His website's cancerfungus.com, and it's Dr. Simoncini, and he's an adorable Italian gentleman, and he believed that cancer is a fungus. And actually, he's not the first person that said that. But if you go back and look at the annals of microbiology, a lot of people think that bugs cause cancer. For example, HPV causes over 40% of head and neck cancers.
Ooh.
All right. HPV also causes rectal cancers. H. pylori causes stomach cancer. Hepatitis B or C causes liver cancer. So there's always a bug connection to the illness. All right. So we always, when we are practicing doctors, we need to look at all the facets of an illness. We talked about emotion, but we also talked about nutrition. We got to talk about the infiltrative aspect by bugs. Okay. There's a lot of new things about Epstein-Barr.
Yes, we just did a show with that.
Yes, and almost everybody has that. It comes and goes. All viruses, they're either awake or asleep. We've got to create asleep or organisms, okay? We've got to create a system. The milieu of our body has to be so that no organisms can grow. So the organisms, whether it's viruses, bacteria, fungi, or parasites, can grow in the body and be a source of inflammation, a source of real invasion to the body. For example, parasites. Parasites are horrible. They're very, very difficult to kill. And people don't understand, it's not just the bug itself, it's the toxins that the bugs make. They all produce garbage and every single day. So, you have this, everybody has a myriad of symptoms, and you got to make sure what it is. And it's not so easy to diagnose. There's no absolute beautiful blood test, beautiful stool test to evaluate what it is. But let's go back to that prostate cancer patient who had a PSA of 1, and then he went to 2, and 2 is not high. It's not even borderline. It's not even a crisis. It's usually not anything to look. But because I had a history, that's why it's very important to see the same doctor all the time. And now with the new system, you're seeing a different person every time. And then they're getting this new uptake, and they don't even really know who you are. So how in the world would they possibly take care of you? So this is something people need to really understand. And I've been doing this 31 years. And my patients, they want to see me. They don't want to see my assistant. Now, sometimes they will if it's something small, but they want to see me. And I know I take an uptake on the patient. I know on all levels there's something not right or something is really right. All right. Okay. So that gentleman with a PSA, he, like I said, he's not taking any medicine. He's perfectly fine. Just came in with his annual physical. He went to go get a color Doppler ultrasound. The gentleman said, "Oh, I think there's a little something." I ordered an MRI. The patient says, "Dr. Connealy, I'm not interested in a biopsy. I'd like to just see what I can do naturally." I said, "Okay, we're going to do these blood tests because I want to look. What are the hormones like? What's his testosterone? What's his estrogen? How is his pituitary function? Does he have high prolactin?" So forth and so on. And so I did that. He went on an herbal chemo protocol. All right. And now he's cancer free. And so, and he always tells his story, and he always says, "Dr. Connealy, can I just, can I be your advocate? I want to be your ambassador. I want guys to know like what happened to me. Like I was just going in for a physical. I didn't have a high PSA. I fixed myself." He learned about himself, obviously changed his eating. He's doing liver cleanses. He's doing infrared sauna. He's doing all the necessary things to create order in our body. That's what we have to do, is we're creating order in our body. Okay.
So you mentioned herbal chemo. So what does that look like?
Well, it's interesting. About 20 years ago, I was at a conference and it was an anti-aging conference. And this gentleman I met, Bill Curry, and Bill Curry was the longest living osteosarcoma survivor. Okay. Osteosarcoma is a fatal disease for our listeners. It is cancer of the bone and muscle, and literally it's fatal, and every single patient's died. So he was telling me his life story. I was telling him my life story. So of course we bonded and we were crying about our life stories. And, I said, I tell people there's pity and there's compassion. So we had compassion for one another. And so then he became one of my mentors, because when he was diagnosed, when he was 22 years of age, I met him in his 50s, but when he was 22 years of age, he was diagnosed. He was hit by a drunk driver. The inflammation a year later caused the osteosarcoma. unfortunately. So the only treatment at that time was amputation. So he's like, I don't want to lose my leg. Well, he asked the doctor if he knew, he asked the doctor who was going to do the surgery, do you know my name? And the doctor didn't know, because unfortunately, a lot of doctors just go in and not even know the patient, right? So he says, oh, if you don't know my name, I'm out of here. So he signed out AMA. He spent the next 11 years, not months, 11 years figuring out how to save his leg and cure himself of cancer. So fast forward, I meet him already cured, already. So he basically downloads everything he did, everything he found, and everything he's done. And he met this doctor. He was lecturing at a big cancer conference in China, and his lecture was translated for the Chinese doctors. And he met this Dr. Wong, who's still alive. He's in his 70s, looks 50, and he's a savant. This doctor, he's a medical doctor. He's one of the most decorated doctors in China. And he's amazing. We've seen him. He has taught one of my staff a lot of things. But anyway, so he has this herbal chemo. They're herbs that act like chemotherapy, but don't hurt you. What a concept! And so anyway, this has been around for hundreds of years. Okay, it's not like it's been around just a short time, and it's withstood the test of time. I personally have been using it for 20 years. Now, they were brought to the United States 25 years ago by this gentleman. So anyway, I test him bioenergetically, which is the new field of medicine, is bioelectromagnetic medicine. And so I tested him to see what he needs. And then every visit, every 4 to 6 months, he got tested. And every visit he got down to 0, where he is now, okay, of not needing anything. Now, cancer is a chronic illness like diabetes and heart disease. So you're checking to make sure you're okay. So it's not like, oh, I'm cured and I never need to check anything again. Well, no, you're a different person every visit. I explain to patients, you're not the same person last visit. But we always want to make sure, not make sure once. We need to make sure 3 times. Because I've learned in 31 years, you can't just go, oh, the biopsy was normal and everything's hunky-dory. No, I've had many patients that biopsy normal and it was cancer. Or patients had a cyst in their breast or a cyst in their ovary, and they go, oh, it's just a cyst, no problem. No. You need to make sure that cyst is really a cyst and it's not a brewing inflammatory cancer, right?
Yes.
Because, and cysts can come and go. Yes, cysts can. Women have ovarian cysts all the time. They come and go, but we always got to make sure. And in this day and time, because my youngest patients are 18 and 20 and 22, I have a 24-year-old with stage 4 ovarian cancer. So in this day and time, I don't let any stone unturned.
Very good. And so we're going to continue this because, finding out what your deficiencies are will help build the body and balance the body is what I'm hearing you say.
Yeah, you have to find, we now know we don't have to guess anymore, Lillian. We can test with everything and know.
Very good. And we're going to continue our conversation. Remember, 10th caller or texter, 407-373-5959, The Cancer Revolution with Dr. Leigh Erin Connealy. And we'll be right here waiting for you worldwide at whenyounneedafriend.com. Okay, so Dr. Connealy, talked about herbal chemo. You talked about a man. What are some of the things that men can take? Because when we come back, I want to shift to ovarian, and I don't know if we have enough time for that. Can you imagine? It was already our 3rd segment. So what can men take for prostate health and prevention?
Well, the biggest thing they can take is saw palmetto.
Saw palmetto?
Herb, saw palmetto, a very, very strong tincture of saw palmetto. Now, there are other things. There are a whole array of supplements like pumpkin seed and zinc and saw palmetto and pollen, all these other things that, are really, really good prostate plant sterols, a really good combo prostate supplement. And gentlemen, and now people probably should start taking things early, probably around 50, give or take, because and get their hormones checked, because if your hormones imbalanced, that's when you get the prostate cancer. You don't get prostate cancer at 20 and 25 and 30. Yes, there are other reasons, because we have a bioaccumulation of toxins in the prostate.
And that's another thing that, you know, we learned at the conference. And I just got back from the Institute of Functional Medicine conference, where they focused on the toxins in the body.
Yeah.
And
right. So probably the single greatest thing people can do is, one, really be conscious of what they're eating, and eat foods that nourish, strengthen, and heal their body.
Real quick, what are those foods? If you whole food, plant-based?
Lots of veggies. And I tell people, more plant-based. And if you don't like veggies, puree them, juice them, okay? Take them in a powder. Like, you know, I know people don't, you know, like veg. I mean, not everybody likes veggies. You know, they like meat and potatoes, or they like whatever, you know. So, but I tell people there's other ways to get veggies in your body. One of the biggest supplements in foods is broccoli, but there's broccoli pills. There's beautiful broccoli pills now. So there's no reason for us to not supplement with something like that. And then cleanse. If everybody bought an infrared sauna, my business would probably go down probably 70-80%, because, you know, sweating and detoxing from the inside out is beautiful, because one of the biggest culprits we have is xenoestrogen. Xeno is the Greek word for foreign, and there's so many hormone mimickers and hormone disruptors in the body that are creating such havoc on all patients, not just prostate cancer patients, but all patients. So I would recommend that people, one, get away from all plastic. We can, as much as possible. You're not going to get completely away.
Yeah, because there's not that much information on BPA free yet.
Right. Well, no, I don't even recommend BPA free. Forget that. Okay. Forget that. No, you need to stick to glass, preferably, or steel. Steel, the taste of the water changes. So I'm not very fond of steel. I personally use glass because the taste is better.
Yeah.
So, but if everyone just cleanse their body, one other thing that people could take every day and it's tasteless is zeolite. Zeolite is zeolite, Zeolite. I've researched zeolites for over 15 years. There's thousands and thousands and thousands of studies on zeolite. Okay,
What is it?
It's a volcanic ash mineral that has the same configuration of a honeycomb and captures the chemicals and toxins and brings it out of your body. It's a very, very beautiful, smart, cheap, inexpensive molecule.
And you put it in your water?
And you put it in your water, right? You put it in your water. And so you just put it in your water, or you spray it, or, it's like, it's very I'm telling you, it's so inexpensive, and it's so easy to use, and so beneficial.
So instead of salt, you can put the zeolite?
Yeah, you can put the zeolite. It's just easy. It's so easy to do.
Very good. Very good.
But they don't, we all, unfortunately, is advertised is things that really don't really help us.
Yeah.
And the world doesn't know all of these. Health is a secret.
It's a secret that is not a secret.
Yeah, well, it's not, but it is. And so if we could let everyone know, how to attain true health, I mean, just think how the world would be, and think how great our country would be, and how nice we would be to one another.
Yeah.
We just esteemed health. In this country, we don't esteem health, whereas other countries, they esteem health. U.S. ranks, 50th in the world in healthcare. We spend the most, but we rank 50th. How's that possible? Third world countries are better than us. How is that possible? Yeah. And just with a few changes, but we need to start with mothers that want to be mothers, of how to have a healthy baby, and how to cleanse your body before, because the bottom line is we're living in a toxic world.
Yes, absolutely. And we're about to get started here. So This is our last segment, Dr. Connealy. We're going to talk about ovarian. We're going to switch, and then I'm going to have people join the YouTube and listen to you. Okay, welcome back to the Lillian McDermott Radio Show, where we always learn from one another. And today's teacher is Dr. Leigh Erin Connealy, 10th caller texter, the Cancer Revolution. I'm telling you, it's a groundbreaking program to reverse and prevent cancer. And you can get a hold of...
It's for cancer, Lillian, but
yes,
any disease process would get better following that book.
Absolutely. Absolutely. You have the keys to maintaining that health and balance. And for those of you who would like a copy of this book, 10th caller or texter, 407-373-5959. I'm telling you, you want to go to whenyouneedafriend.com, watch the YouTube video with Dr. Connealy. Lots of pearls, lots of information that we're not just able to talk on the air. We're going to shift a little bit. We're going to talk about ovarian cancer. Ovarian cancer is called the silent killer. There are sometimes no symptoms. What can you tell us about ovarian cancer? Because I know that the prostate cancer and ovarian cancer are like neck and neck.
Right. They're anatomically, the prostate's very similar to the ovary. Yes, you're right. Well, unfortunately, you're right. Ovarian cancer, the reason why most of the patients die is two reasons. One, you said it's silent. Yes, it's not something that is that's given. It's not given attention, and you don't have any pains, because the reason why you don't have any discomfort, Lillian, is your abdominal pelvic cavity is large. So if something is growing a little bit, you won't feel anything, right? So, and if it grows a little bit bigger, you don't feel anything. So then, unfortunately, when it grows too large, then you feel something. And then the doctor goes in, they order an ultrasound, order scans, and then they go, oh my God, you have ovarian cancer. And then what is the treatment for ovarian cancer? Radical debulking surgery and chemotherapy. And then when you open up the abdomen and pelvis, and you just spread all the cancer cells. So unfortunately, the cancer comes back, and what happens is you start that process, and then the patient just goes downhill because the cancer come back, and then over the next couple of years, it's terrible.
Okay.
So one of the things that patients can do, like really, patients need to. What I have started to do is an ultrasound once a year.
Okay.
Because a lot of my patients want to take hormones. I'm an expert in hormone replacement therapy. And so I tell patients, let's do an annual pelvic ultrasound. Then it's relief, and I know, and let's just do it. Okay. It's not that common. So that will cover endometrial cancer and ovarian cancer. So since cancer is growing, let's just do pelvic ultrasounds, no pain, it's not expensive, and no radiation. Okay. So simple, right? So, and then on the blood test, like there's blood tests. Now, cancer markers are not revealing. So people cannot use cancer markers as indicators for cancer. Okay. There are a couple cancer markers that are really, really good for cancer. That's the CRP, C-reactive protein. If your C-reactive protein is over 1, something bad is happening to your body. So you need to get checked. You need to go to the doctor. Now, most doctors, unfortunately, Lillian, don't know how to treat CRP, because is there a drug for CRP? No. So what do doctors do? Prescribe drugs. So they just go, oh, it doesn't matter. Well, no, it matters. It was on the cover of Time and Newsweek. You heard me talk. No, it matters. Why do we have it as a blood test if it doesn't matter? Okay. Yeah.
So the blood test is CRP. The blood test is CRP. And if it's greater than 1.
Every doctor can do it. It's not an esoteric blood test. Do yourself a favor. So CRP, it's just like, come on, this is ridiculous. So CRP, so if it's elevated, then I go looking. And then what I usually do is I give patients essential fatty acids. Essential fatty acids or omega-3s. I usually use vegetarian, because vegetarian, I use something that has like 10 different vegetarian oils as opposed to 1, and omega-3s. But whatever, kind of just get on some. There's Udo's oil. There's I use my own private label of PEOs. And then sometimes I have patients do omega-3s. But anyway, the bottom line is get on oils. We all need an oil change. Why do we need an oil change? Every cell has a membrane. The membrane is made up of essential fatty acids. They're called essential because you need them, right? So do yourself, everybody should be on two things everybody should be on every day is
Okay.
essential fatty acids and vitamin D. Vitamin D influences over thousands and thousands of genes in cancer. Get on vitamin D. I don't care. Let's say you don't even have a blood test. Maybe you can't afford it. Maybe you don't. Just get on 5,000 vitamin D. Most people need 5 to 10,000. Get on 5,000. It will not be toxic. I've never seen in 31 years anyone have toxic side effects of vitamin D. Ever.
Okay.
Ever. Okay. No one's overdosed on vitamin D. Okay. We don't know. Maybe high vitamin D's cure us. Who knows? We don't know because we've never tried it. Okay. So just, come on. There's people die every day of medicine. It's cheap. Oils and D are cheap. So people, one message is people need to just do those two things. And I made a supplement, omegas and Ds, because I'm like, this is simple. They only have one pill to take. This is not complicated. So vitamin D and the other blood test that I always talk about is the hemoglobin A1C, which is done on every man, woman, and child. A hemoglobin A1C is a reflection of your blood sugar and aging over 90 days. So if your hemoglobin A1C is high, you're aging and you're creating prediabetes or diabetes. So why is that important? Because we know that prediabetes and diabetic patients have higher risk of all diseases. Cancer, heart disease, every disease is related to high sugar. So we all need to do ourselves a favor, is get over the addiction of sugar. There are lots of ways to get over the addiction of sugar. My first practice was on weight loss. So I'm an expert in that because, when I was younger, I wanted to lose weight and blah, blah, blah. But we have to address our addiction to sugar. And sugar is a poison. Sugar destroys our body. Sugar destroys the immune system. And it's not just sugar, it's carbohydrates also. So we've got to replace all that sugar with good fats and good plants and some protein. And people will feel better if they eat fat over sugar because fat is satiety. It causes satiety, which means fullness. And sugar, you're hungry in an hour. If you eat a bagel, you're hungry in 1 hour. Yep. So you're wasting money because you're hungry in an hour. So then you want to go get something more to eat. So if you eat fat has 8 hours of long-lasting energy. Carbohydrates and sugar have about 30 minutes of energy. Well, I want 8 hours of energy. And so if you think about how much money you spend a lot less money, a lot less aggregation, and your moods are so much better. What a concept.
Sure.
We need to focus on fats, all different kinds of fats.
Okay, so vitamin D, essential fatty acids.
Yes.
And so if someone...
Sugar. And let's say you love, one of my patients says, I really love ice cream and oatmeal cookies. And she lives in Texas. I talked to her last night. And I said, okay, you can have the piece of organic, great chocolate, but get rid of the oatmeal cookies and the ice cream. Okay. And I said, she wasn't diabetic yet, but I said, your sugar's already going high. You have inflammation. I said, just get off that. You're going to be fine. Go grab a tablespoon of almond butter. Go grab a tablespoon of nutso. Go grab a tablespoon of chia seeds. Go, there's all kinds of things and you will feel better. And then you get that oral satisfaction, when you eat peanut butter and almond butter and that you get this oral, we need the oral sensation.
Yes.
And so you just will do yourself a favor. So those three things are huge, humongous things that people can do.
Well, Dr. Connealy, there's never enough time when you're on the show. This is important. If somebody has cancer, real quick, because we have 1 minute left, do you encourage them to stop, take a breath, and wait before they choose what they want to do? Because many doctors are going to lead you to slaughter and go chemo.
Well, no, they scare the patient to death, Lillian.
Yeah.
And that's not where it is. Waiting a day, a week, a month. The most important thing is be calm, cool, and collected and say, look, I need someone. You need an advocate. Get someone to work with you and say, look, let me go do my homework. Let me start reading everything I need to read and read everything. If you see the same thing mentioned all the time, like what I say and Dr. So-and-so and Dr. So-and-so, there must be some truth.
Absolutely. Dr. Connealy, thank you so much for sharing your wisdom. I know that you're making a difference in the world. To you, my listening friend, once you learn the truth, you cannot unlearn it. So be responsible. Check out an alternative way to heal, mind, body, and spirit. Please remember, I'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. There you go. Okay, real quick, because there's just so much. We didn't spend a lot of time with the ovarian aspect of it.
No, but that's for another time.
I know you're just coming back, aren't you? So here's the thing. Women that have ovarian cancer, people that have cervical cancer, with the work of Dr. Hammer, there's been some form of a sexual violation, trauma in the person's life. I know that Louise Hay had mentioned her personal, when she was raped when she was 5.
Right.
And so that mental, emotional work, is there anything connection to the prostate and the ovary?
Yeah. Oh, yeah.
When it comes to Hammers.
Every cancer has an emotional component. Everyone. So breast is unrest in your nest. Okay. Lung is you're grieving. If you have lung cancer, you're grieving. You have fear of dying. So, every cancer has.
What about prostate and ovarian?
Prostate is they're very, very. There's a sexual conflict, and they're very OCD fastidious. Every single one of them are like that. They don't know how to be calm, cool, and collected. They're like, wound up. They all have a very classic personality. So I've got to bring them down and get them in reality. And luckily, guys are fine with me because I let my male side help them, if you know what I'm saying.
Yeah, sure.
Not my female side, my male side. And so
is it true also, Dr. Connealy, with ovarian cancer?
Ovarian, I'd have to look up exactly.
Yeah.
I'll look it up and I'll have Kitty email you.
Yeah, because I know that the left side of the body is associated with a female and the right side of the body is associated with a male. Right. So I didn't know if that was true also with the right ovary, left ovary.
Yeah, probably. Yeah.
I wonder if all of that, but that's what I'm talking about is the work of Dr. Hammer. Is it Reiki Hammer? Yeah, he is amazing, and the work that he's done to help with that emotional. I mean, it's been years and years and years that he came up with this, and so it's wonderful to hear a doctor who's an MD say, doctor. I don't know if you're familiar with Dr. Leigh Cowden.
I know, he's one of my best friends,
No way. Okay. So Dr. Leigh Cowden said, and maybe you can reply to this. He said, if you deal with the emotional, if you are sick or even if you're well, if you deal with the emotional aspect of it, healing will be faster.
Oh my God, dramatic.
Radically. Yes. And then he said, if you don't deal with the emotional and the mental aspect of illness, healing the body will be very expensive and very long.
And yes, and if you have lots of stress, lots of emotional stress, cancer grows. It's like adding kerosene to the cancer.
Yeah, and you talked about the work of Dr. Simoncini, or I don't know if that's how you pronounce him.
Cancerfungus.com. Yeah,
Cancerfungus.com.
You should go to his website just for educational purposes.
When you're talking about, you talked about, we just did a show on Epstein-Barr. And how it associates with cancer with
Medical Medium. Have you seen that book?
No.
Oh, so Medical Medium. I can't think of the guy's name. He's written several books. He's coming out with another book on liver. He's supposedly this savant guy that just has this insight knowledge. Maybe he does, maybe he doesn't. I don't know. I don't know if he's worked with a doctor that has proven what he says. If you know what I'm saying. Mm-hmm. So that's what it sometimes bothers me, these non-medical people pontificating all this great, which, may be true, maybe not.
Mm-hmm,
okay?
mm-hmm.
Like Bill Curry wasn't a full-fledged doctor like me, but he knew as much as a doctor. But other people, and has this guy been sick? I don't know. Look it up, Medical Media.
Yeah, well. And so you were talking about him. What were you going to say about him?
Well, he talks about Epstein-Barr in his book.
Oh,
The whole thing is Epstein-Barr and
yeah.
So
Well, but there's that connection.
All the electromagnetic fields are making all of these bugs more prolific.
Yes. And so if you are dealing with somebody who has candida, which you said that there's candida in the prostate and there's candida in the ovary.
Almost in everyone, so unfortunately.
Well, let's talk about overgrowth. How do you bring the overgrowth down? What is
I change their eating. I put them on Candicid Forte. I put them on.
What is Candicid Forte?
Candicid Forte. It's a pills. It's capsules. A natural stuff. And then I put them on acetaldehyde drops that gets rid of the acetaldehyde, which is the mycotoxin that candida makes, right? So I do those three things. Eating, you got to go on a candida diet. So I have a candida diet handout, and then I put them on Candicid Forte and acetaldehyde, and it's dramatic, the difference in how everybody feels.
And then once that fungus is gone or that virus is gone, then you can heal cancer.
Well, no, you're doing everything all together.
All together. Okay. So I didn't know if you first work emotional, then you work.
Yeah, you have to get in front of this illness ASAP.
Mm-hmm.
So it's a lot of work in the beginning. But once you do it, once you get it, give yourself a month or 6 weeks, you're dialed in, and this is your new way of life. I tell people you're just replacing this old way with this new way.
And you hear all these people that are treated the allopathic way, years of chemotherapy, years, and they're still like walking dead. Yeah. So for those of you who are wanting to know where you can get a hold of Dr. Connealy, it's ConnealyMD.com. And if you are wanting to heal your body, Cancer Center for Healing, and then if you want to heal from cancer, but if you want to make sure that you are
and optimize your body,
which I want to go and get a workup from you. It's the Center for New Medicine. You can always go and heal mind, body, spirit. Thank you so much, Dr. Connealy. I'm looking forward to the next time. We just got to keep talking.
All right. Thank you, Lillian.
Take care.
Have a great day.
Bye.
Bye-bye.